Hello, my name is Jessica Davis. I am the CME coordinator for the Indiana State Medical Association. The ISMA is happy to provide today's webinar on navigating the 2021 Medicare Open Enrollment. Your speakers today are Tom Martins, ISMA Insurance Director, who has extensive experience administering individual and group health insurance for ISMA members, their families, and employees. And Donna Mallinckrodt, ISMA Medicare Specialist, who has committed herself to educating and assisting injured ISMA members and their spouses about ISMA-sponsored health insurance, especially those who are or soon will be on Medicare. Please note, CME is not being offered for this webinar. This webinar is being recorded and will be available on the ISMA Insurance Agency website. This presentation is basic Medicare information. It is not a substitute for supplemental plan material, materials provided by Medicare, or materials provided by an employer. This presentation should not be the only source of your Medicare education. Following the webinar, we ask that you complete the survey. For this live broadcast, a SurveyMonkey link will populate in the chat at the end of the webinar. If you have any questions during the webinar, please submit your questions through the Q&A button located at the bottom of the screen. Questions will be addressed at the end of the presentation. Thank you all for attending. I would now like to turn it over to Tom.
Thank you, Jessica, and welcome everyone. As physicians and spouses approach age 65 throughout the year, and especially during the Medicare open enrollment period that we're in right now, we received quite a few calls with questions about Medicare, Medicare supplemental coverage, and Medicare drug plans. So we thought it might be helpful to talk through these topics in a webinar, and we're delighted that you could join us today. So we'll begin with about a 30-minute presentation, and then we'll be happy to answer any specific questions that you have, which again, you can submit at any time through the Q&A. So let's get started. First, Donna, exactly what is Medicare?
Sure. Medicare is a federal health insurance program that helps with the cost of health care for individuals age 65 and older. It's managed by the Centers for Medicare and Medicaid Services, and Social Security works with CMS by enrolling people in Medicare.
Okay, and now who is eligible for Medicare and when do they become eligible?
Well, there are actually three groups of individuals that qualify for Medicare. The first are individuals that are turning age 65. The second are individuals retiring after the age of 65 who were previously covered under a large employer group health plan. And the third are individuals under the age of 65 who qualify for Social Security disability.
Very good. And next, can you give us a quick overview of the different parts of Medicare, A, B, C, D? It's kind of like an alphabet soup.
It is. So Part A covers medical care in the hospital and skilled nursing care following a hospital stay. Part A is free of charge as long as the individual has worked for a minimum of 10 years. Part B is referred to, or Part B covers things like medical insurance for services from a doctor's office, outpatient care, ambulance services, chemotherapy, and some diabetic supplies. Part B pays about 80% of Medicare eligible claims. The monthly premium starts at $144.60 and increases according to the subscriber's income level. So simply stated, higher income earners will pay more for Part B. And Part C is a Medicare Advantage plan, which is an all-in-one alternative to Original Medicare. These bundled plans include Part A, Part B, and usually Part D. Subscribers stay within an HMO or PPO network. Most plans offer extra benefits like vision, hearing, and dental. And subscribers will pay the Medicare Part B premium and perhaps a monthly premium for the plan itself. And Part D is a prescription drug plan that's offered by an insurance company. Part D plans are most often paired with Original Medicare and a Medicare supplement plan.
All right, great. So when it's the right time for an individual to apply for Medicare, how would they go about doing that?
Well, there's three ways that they can apply. They can apply online through ssa.gov. They can call Social Security at 1-800-772-1213, or they can visit their local Social Security office, that is, if it's open, and they can apply in person. Sometimes Social Security recommends that subscribers that are approaching the Medicare age call the 800 number first to make an appointment. And individuals who have not worked 40 quarters or 10 years who want to apply for benefits under a spouse's work record will need to apply in person at their local Social Security office. One other thing of note is subscribers who are already enrolled in disability will automatically receive their Medicare ID card in the mail about 3 months before they turn 65, so they don't have to do anything.
That's nice. And I think we talked yesterday about the fact that the Social Security office, or at least some of them, are even offering Zoom meetings right now because
They
of COVID.
are. Yeah, I know that the Social Security offices in Indianapolis are offering Zoom meetings, and I think that that's beneficial, especially in this day of COVID.
Yeah, definitely. All right, so we just talked about how to enroll in Medicare. Now let's kind of zoom in on some specific situations. So the first is applying for Medicare at age 65. And a physician would typically apply for Medicare at the age of 65 if they're in one of three situations. They're either retired, or they are still working and they receive insurance from an employer with less than 20 employees, or they're buying individual health insurance, like the ISMA sponsored individual insurance that's not through an employer. So when does a physician who's in any of those situations enroll in Medicare?
Well, the initial enrollment period actually lasts for 7 months. It begins 3 months before the month they turn 65, includes the month of their birthday, and then it ends 3 months thereafter. Coverage begins on the first day of the month that the subscriber turns 65. So using an example of November 17th, Medicare will actually begin on November 1st. However, if the birthday is on the first day of the month, coverage will begin on the first day of the prior month. So an example is someone who's born on November 1st, their coverage will actually begin on October 1st.
Okay. The other very common situation that we run into is physicians who receive employer-provided health insurance from a large employer. And by large employer specifically, we mean an employer that has 20 or more full-time employees. So when these physicians reach the age of 65, they have two options. The first option is they can continue their employer-provided health insurance, which will continue to cover them exactly like it did before they turned 65. Or the second option is they can waive coverage through the employer. They can start Medicare as their primary insurance, and then they would purchase Medicare supplemental coverage. So, Donna, what are some things for physicians in this situation to consider as they decide on one of these two options?
Well, if the physician has a spouse or children who are currently on their group plan, it might just be easier to remain with the employer to avoid having to find coverage for their dependents. But if not, figure out what the contribution or their cost is for group health insurance and what the benefits look like under that plan, and then compare it to what they'll pay under Medicare Part B, a Medicare supplement, and Part D. Consider the fact that Medicare does not have a huge deductible. The 2020 Medicare Part B deductible is $197. And they might find that signing up for Medicare at 65 makes the most sense financially, even if they're entitled to a special enrollment period later. My advice is to perform a few calculations to determine which plan is more cost effective.
Okay, that's good advice. And for a physician who continues their employer-provided health insurance, this is someone who's working for a large employer. They continue that insurance after they turn 65, and then eventually they retire. How do they go about applying for Medicare when they retire?
Sure. So when a physician and their spouse retires after the age of 65, they'll enter an 8-month Medicare special enrollment period. The period actually begins the month after employment ends or the month after insurance ends, whichever comes first. So if you can plan ahead, please do. As soon as you know your retirement date, contact Social Security to avoid a gap in coverage. And if you sign up for Part D, be sure to keep your eyes out for any mail from that company where you're enrolling, because they'll send out a questionnaire from the company that needs to be completed and returned to confirm your prior credible prescription drug coverage. And if you miss that letter and fail to send it back, you'll get charged a late enrollment penalty.
Okay, yeah, that's a good point that you bring up there. Insurance carriers are required to send out to subscribers who are age 65 and older every October either a certificate of creditable drug coverage or a certificate of non-creditable drug coverage. And so a physician who's in this situation should hang on to those certificates, well, particularly if they have a certificate of creditable drug coverage, because they may be required to present that to document the fact that they had creditable drug coverage through their prior health insurance, like you said, to avoid a penalty. COVID has had a significant impact on some physicians' practices, and we've heard from a few who had been contemplating retirement, and because of COVID and the impact that that's had on their practices, they've decided to move that up, and they're retiring in 2020. But most of the time, I think physicians do plan their retirement, pretty significant amount of time in advance. So you said that the Medicare special enrollment period is 8 months, but when really is the best time for a physician in this situation to actually apply for Medicare?
Well, I would probably give Social Security a call once they know their date. So if they know that they're going to be retiring on 12/31 of 2020, they can call Social Security now. Social Security will require some documentation of their current coverage in order to enroll them under the special enrollment period. And so the back and forth between sending paperwork in and having it received by Social Security can take a few weeks. So in this case, sooner is certainly better than later.
All right, and now I think we have a couple of bullet points that we might just call tips and tricks that kind of fit in here, but they're also related to health savings accounts.
Yeah, so an individual with a health savings account who continues to work for an employer after age 65 can continue to make pre-tax contributions as long as they do not enroll in Medicare Part A or Part B or Social Security benefits. HSA funds can be used to pay for eligible medical expenses and Medicare Part B and Part D premiums, and of course, Medicare Advantage premiums if they enroll in an Advantage plan. But HSA funds cannot be used to pay for a Medicare supplement plan, such as the ISMA Medicare supplement.
Mm-hmm. Okay, and just expounding a little bit on that first bullet. So a physician who's working for a large employer who receives health insurance from that employer, when they turn 65, as we said earlier, they do have the option of going ahead and starting Medicare Part A at no charge. And if they
Correct.
do, it would pay secondary to their employer provided insurance. But if they have an HSA and they want to continue to make contributions to that HSA, then they may want to hold off on starting Medicare Part A because once they start Medicare Part A, they can no longer make HSA contributions.
That's absolutely correct.
Okay. When a physician is ready to start Medicare and some kind of supplemental coverage, what are the two main approaches or options?
Sure. So there's original Medicare, which includes hospital, which is Part A, and medical, Part B insurance. And most subscribers will include a Medicare supplement plan, like the ISMA Medicare supplement, to help pay out-of-pocket cost. About 70% also enroll in a separate drug plan, known as Part D. Now, a Medicare Advantage plan is an all-in-one alternative to original Medicare and is administered by a Medicare-approved insurance company. These bundled plans include Part A and B, and usually Part D. Most plans offer extra benefits like vision, hearing, or dental.
Okay, so let's take a closer look at both of those options. The first one that you described involves Medicare Part A and B, which again is sometimes referred to as original Medicare, plus a supplement like the ISMA Medicare supplement and a Medicare Part D drug plan. So do you want to talk a little bit more about the ISMA Medicare supplement?
Sure. So the ISMA Medicare supplement is a high-quality, affordable health plan designed just for ISMA members and their spouses. So Medicare pays about 80% of claims, and the ISMA Medicare supplement is designed to pick up the other 20% of eligible expenses. ISMA currently offers a first-year discount for members who are new to Medicare, and in 2021, we're adding a second and third year discount as well. So with the discount, subscribers at the age of 65 will pay a premium of $115 per month and the Medicare Part B deductible of $197 per year. Because Medicare covers 80% of claims, the ISMA Medicare supplement is designed to pick up the other 20% of eligible expenses. So with this, you can actually calculate how much your medical expenses are going to be for the coming year by taking wherever your Medicare Part B premium happens to be. Again, that's according to your income, timesing that monthly premium by 12 months of the ISMA Medicare supplement, and whatever Part D charges, you can actually make a pretty good prediction of how much you're going to spend on health care. And the main thing with the ISMA plan that's very popular with our subscribers is that they can go to any physician that accepts Medicare assignment, most importantly, without a referral.
Mm-hmm. Yeah. One more thing that I'll mention about the ISMA Medicare supplement is that in 2019, Silver Sneakers was added to the plan, and that's been a big hit. It provides a free health club membership, and there are fitness centers across the country. So even for those physicians and spouses who are snowbirds, they might spend part of the year in Indiana and part of it in Florida or Arizona or someplace. They shouldn't have any trouble finding a participating health center.
That's correct.
Yeah. And a significant number of ISMA members and spouses participate in the ISMA Medicare supplement.
Yes, and we certainly have a good number of our physicians that live in Arizona, out in the Southwest, or California, or Florida, or one of the warmer weather states. And yeah, and so that is a very, very big positive point of having a Medicare supplement plan versus an Advantage plan where you have to stay within the region. You have to use the HMO or PPO physicians. And so traveling sometimes gets in the way with that.
Yeah, right. Well, so yeah, that really kind of leads into this next slide. Since we've started working remotely back in March, oftentimes during my lunch breaks, I'll flip on the TV, and during the past month or two, I've seen quite a few ads for long ads, I might add, for Medicare Advantage plans that cover dental, vision, and hearing in addition to medical costs. Some plans have low or no premiums, and on the surface, that seems like a great option. But what's the catch?
Yeah, they do market those plans quite well. So Advantage plans can be referred to as a pay-as-you-go plan. That means each time you see a provider, you may have copays for medical services. You may be required to use a limited network of providers, and you may have a deductible for a hospital stay. You may need referrals to see specialists and prior authorizations for hospitalizations and tests. These requirements are utilized to control cost. Most plans have an out-of-pocket maximum, which can be thousands of dollars. Additionally, it's really important to note that the plan can choose not to cover the cost of services that the insurance company doesn't consider to be medically necessary. So individuals who choose Medicare Advantage plans should be sure to check with their insurance company before receiving costly services.
Yeah, so yeah, lots of things to think about there.
Lots of things to think about.
Okay, so if any ISMA member, after considering options, decides that they want to enroll in the ISMA Medicare supplement, how would they do that?
Sure. So members and our spouses already enrolled through the ISMA in our health insurance program are automatically transitioned to the Medicare supplement plan when they turn 65. So they'll receive a packet of Medicare information about 3 months before their birthday, reminding them to enroll in Medicare and how to do so. ISMA members not insured through ISMA should complete an Anthem enrollment form. Their spouse can apply for a separate policy if they're not yet 65. Underwriting approval is required for all new applicants.
Okay, so yeah, this just kind of makes me think about those physicians who are working for maybe a hospital or another large employer that's providing them with health insurance. And when they retire, as long as they're an ISMA member, they're eligible to apply for the Medicare supplement for themselves. And if they have a younger spouse, they can apply for an ISMA individual plan. And we're happy to help them out with that. It's a very valuable service that ISMA offers.
Yes, I agree. And additionally, I might add that they can apply for the ISMA supplement at any time during the year. They don't need to wait until January 1 or open enrollment to apply for our plan.
Yeah, good point. All right, whether an individual goes with original Medicare, a supplement, and a Part D plan, or they go with Medicare Part B and a Medicare Advantage plan, either way, they're going to have to pay a premium for Medicare Part B. So how is that calculated?
Yeah, so the income-related monthly adjustment amount is known as IRMA. And so IRMA is basically an amount that higher income earners pay for Part B and Part D. So just about all ISMA physicians fall into this category in one tier level or another. So Social Security determines if they owe IRMA based on the adjusted gross income reported on IRS tax returns from 2 years before the year that they start paying IRMA or enroll in Medicare. So if a physician is enrolling in Medicare, let's say February of 2021, the IRS is actually going to look at their records from 2019, and they'll determine what the IRMA is from looking at the adjusted gross income. For someone that enrolled in 2020, then the IRS considered the numbers from the 2018 tax returns. So we actually have a document called Frequently Asked Questions regarding specific IRMA amounts. They do change every year. And so I'd encourage you to go onto our website at ISMAIA. And if you go to the second page of Frequently Asked Questions document, then you'll find an IRMA chart for 2020. As soon as the new numbers are out, they're not published yet by Medicare for 2021, but when they are, we'll update that information because usually at the end of each year, the numbers change.
Right. Okay. And so, it's good, I think, to bring that up because most physicians are going to be impacted by that IRMA adjustment.
Correct.
But if a physician experiences a significant reduction in their income when they retire, is there anything that they can do to request that their income related monthly adjustment amount be reduced?
Yeah, there sure is. So the IRS publishes a form. It's called the SSA-44, and it's called a life-changing event form. And so if a person that is going to be enrolling in Medicare and their income is suddenly reduced, they can apply for a reduction in IRMA. And the reason for the application is going to be reduced income due to retirement. And I've heard different things from some of our subscribers. Sometimes I hear that Social Security gets back to them immediately, within 3 to 5 weeks and makes the adjustments needed. And then other people have waited for a number of months. So again, as soon as your numbers change due to retirement, then I encourage you to complete this form.
Mhm. Okay. Very good. We talked earlier about buying a Medicare Part D drug plan when starting Medicare and a supplement. There's really more than one reason to consider buying a Part D plan, right?
Yeah. So original Medicare and the ISMA Medicare supplement plans do not include prescription drug coverage. So individuals may want separate coverage for prescription drugs through a Medicare-approved insurance company. Medicare prescription drug coverage is an optional benefit offered to everyone who has Medicare, but enrollment is not a requirement. But if subscribers enroll after the age of 65, they'll have to pay a late enrollment penalty fee.
Okay. And really, the exception to that would be a physician who works for a large employer and waits to start Medicare Part D because they
Correct.
have coverage under their employer plan, as
That's
long as the coverage was creditable.
mhm.
Okay. Um, Individuals can buy or change their drug plan during the Medicare open enrollment period that runs from October 15th through December 7th of each year. Why is it important to use the Medicare Plan Finder tool during each annual Medicare open enrollment period to select a drug plan for the following year?
Sure, good question. So insurance companies move drugs on and off formulary and change tier level assignments, which directly impact what they'll pay out of pocket each year. Just because a plan covered your medication in 2020 doesn't mean they'll continue to cover them in 2021. The plans vary enormously in copays that they charge. In some cases, the cost of a 30-day supply of the same drug can differ by more than $100 from one plan to another. The most effective way to make a comparison is to use the online tool on Medicare's website. The Medicare Plan Finder is really very easy to use, and it automatically recommends the lowest cost plan that will cover your medication in the coming year. So I've just recorded a video on how to use the Medicare Plan Finder. You can find the video at ismaia.com/videos. I encourage everyone to check it out. And if they have problems, they're welcome to give me a call. But chances are you're going to be able to navigate through the Plan Finder without any problems at all.
Yeah, and one nice thing about that tool is that in addition to it being easy to use, is that it will ask you which specific medications you're taking. It'll give you you can start to type it in, it'll give you a list, you choose the drug, you choose the frequency, the dosage, and so it customizes the results just to you specifically.
Yeah, it's a pretty amazing piece of software. So not only does it give you that information, but just the fact that it automatically determines which plan is the best for you, and they determine that simply by looking at the numbers on what you'll pay for copays and what you'll pay for the monthly premium. They also will guesstimate, because drug prices do change on a regular basis, but they'll guesstimate how much you're going to pay each month according to the coverage level that someone is currently in. Well, we've all heard of the dreaded donut hole, and the donut hole is just about eliminated. It's down to 25%. At one time, it was over 50%. So the donut hole is no longer as much of a factor. But under plan details, I really encourage people to get into the plan finder and kind of snoop around, open windows, and anything that you click on that is written in blue will provide more information.
Good, good. All right. While ISMA members and spouses are our customers, and we spend most of our time helping them with their own policies, every once in a while we receive calls from a physician or a spouse who's trying to help a parent or another family member. And what advice do you have for them?
Sure. So first, determine if the family member has limited income or resources, as the state does have programs that help to pay for Medicare premiums, or they could qualify for extra help to pay for their Part D drug coverage. Explain the difference, including the cost, between original Medicare and a Medicare Advantage plan. If original Medicare is preferred, discuss the drug coverage and explain how the Medicare supplement works. And if an Advantage plan is preferred, it's important to research the PPO and HMO options to determine if any networks include the family member's current physicians, and also if they have a preferred hospital, if that hospital is in network as well.
Okay. All right. So for more information on Medicare, we did put together a series of videos earlier this year, which are available at ismaia.com/videos. And we get into more detail in various areas regarding Medicare and Medicare supplements and Medicare Part D. So we would encourage you to take a look at those if you're interested. And with that, I think that we are ready to answer questions that may have come up.
Great, thank you, Tom and Donna. We do have a few questions that have come through. The first one is, so I don't need to sign up for Medicare when I turn 65 if I'm still employed?
That's correct.
Great. The next question, we are new applicants to ISMA Medicare Supplement. On the application form, it asks for a Medicare ID number. I have a Medicare A number and my wife has Medicare A and B. What number should we enter?
Yeah, you can feel free to enter the Medicare Part A number. That will also transition into the A and B number, but that's fine if they just enter the numbers that they have. Yeah, that'll be fine. And if I have questions when I review the application, I'll be sure to get in touch with the applicants, but I don't see any problems with that at all.
Great, thank you. The next question, what if my wife is already on Medicare and I am not, due to being less than 65 years of age? Can she get on the supplement through ISMA? And what all needs to be done to qualify?
Yeah, Tom, did you want to take that or shall I?
I'll be happy to do this one. So I'm not sure who is the physician there, but I'll just answer it this way. So ISMA members are eligible for the Medicare supplement or for an ISMA individual policy, if the spouse, as well as the spouse. However, the spouse is only eligible if the member is insured through ISMA, either through a Medicare supplement or an individual policy. So if this is a situation where the physician is the younger of the two of them, and maybe they're working for a large employer that's providing them with health insurance, so they really don't need it yet, and they're just looking for a supplement for their spouse, then probably they're going to be best served by going with a Medigap plan, which we do not offer until the physician is in need of health insurance, and then at that point, both of you could apply for coverage through ISMA. So hopefully that addresses the situation.
Great, thank you, Tom. Next question, what is the penalty for enrolling in Part D later after age 65?
Yeah, it's a pretty minimal penalty. It's actually 1% of the average premium. So just to use as an example, I think my father neglected to enroll in Part D drug coverage, which is surprising when his daughter is an insurance agent. But he neglected to, and when we finally did enroll him, he went about 7 years without enrolling in Part D, and when he finally was prescribed an expensive drug, he bit the bullet and did it. And I think that he paid about an additional $42. So it's not going to be hundreds of dollars, and he did go for 7 years without coverage. So it is something to consider, and that is a lifetime penalty. So that penalty will never go away. But if someone just waits for, perhaps 12 months, it should really just be minimal, maybe a couple of dollars, but not too much more. If someone has specific questions, they're welcome to contact me about that, because there's actually a calculator that I have access to, and I can put in the date that you were supposed to enroll in Part D, the date that you did enroll, and then it automatically calculates the penalty.
Yeah, and just to clarify a little bit there, I think it's 1% per month for every month that you wait. But like you said, the average premium is such a low amount that when you translate that into dollars and cents, it's not a lot of money.
Great, thank you. We do have a few more questions here. Does auto rollover for ISMA supplement or current Part D happen?
So yeah, I think what this question is asking is for a physician and maybe a spouse who have their health insurance through ISMA as an individual, does their insurance automatically roll over to the ISMA supplement and Part D when they turn 65? So the answer to that is the Anthem policy will automatically roll over to the Medicare supplement through ISMA. Now, of course, you do have the option of choosing not to take that and to do something else, but by default, we'll set that up for you. The Part D enrollment does not happen automatically. We do send a letter, really a couple letters to you, one about 9 months before you turn 65, and the other about 3 months, like Donna mentioned earlier. And the Part D plans are sold directly by insurance companies. There's no association-sponsored Part D plans. So that's not something we can offer, but we do, in the letters that we send to you, we do recommend that you go online, use the Medicare Plan Finder tool to choose a Part D plan.
Great, thank you, Tom. Next question, how do I handle the 6-month retroactive HSA disallowance prior to enrolling in Medicare?
Can you repeat that question, Jessica? I didn't quite get that.
Sure. How do I handle the 6-month retroactive HSA disallowance prior to enrolling in Medicare?
Well, if I'm interpreting the question correctly, someone can continue to make contributions in their HSA account up until they actually start on Medicare. So I'm not really sure what the 6-month is referring to. Tom, do you know what that question is?
I'm not picking up on that. No. 6
So
months.
perhaps the person that asked that question might want to give us a call, and we can figure out exactly what they need to know and help them over the phone.
Thank you. A few more questions here. I think we have time for some more. I've seen AARP Medicare supplement plans offered. How does the ISMA Medicare supplement differ from other plans like the AARP plan?
Sure. So the AARP plan is referred to as a Medigap plan. And what they mean by that is it's a federally administered plan. And that means that anyone can enroll in that plan. So you don't have to have any type of an occupation. You do have to be Medicare eligible, of course, but anyone in the country can enroll in that plan. The ISMA plan is a member-only plan. It's a much smaller than the AARP plan, where very small compared to that. And you have to be an ISMA member to enroll in our Medicare supplement plan. So ours is known as a perhaps just a smaller membership only plan. In reference to our benefits, though, the benefits that ISMA offers are the best that are on the market today. You can't really buy any better than what we have to offer. So we have monthly premium, and then the subscriber can go to any physician that they want to go to. We have silver sneakers. We have also something that we didn't mention before is unlimited out of the country travel. And what that means is with a traditional Medigap plan, they're allowed to have $50,000 in medical expenses before the insurance stops covering them, while ISMA has unlimited medical travel. So it doesn't matter where you are or how many times you travel. If you get sick, then you get the care you need. Come back to the country and make sure you pay everything with a credit card bill. Come back to the country and then submit your claim forms to Anthem, who's our carrier, of course. And then Anthem will pay for whatever claims are allowed to pay for.
Great, thanks, Donna. Another question here. If retirement is planned January 2022, would the IRMAA be based on 2020 or 2019, considering the time needed for enrollment application?
Yeah, it's my understanding it'll be based on the 2020 figures.
Great.
And Jessica, I did want to go back to that very first question, which was someone wanted to know if they're getting close to 65 and if they have a group health plan, do they need to enroll in Medicare? I just wanted to also stipulate that they can enroll in Part A, which is hospitalization, if they have a PPO plan and they're not interested in making HSA contributions. So perhaps for that particular person, Part A should be a consideration. But otherwise, if someone does have group coverage, they don't have to enroll in A and B, but there's no reason not to enroll in A if you have a PPO plan, because it's free of charge. So it could down the road end up helping out with some deductibles or co-pays or out-of-pocket cost in the event a hospitalization occurred.
Great, thanks, Donna, for clarifying that. We have just a few more questions here. My spouse and I are on ISMA Anthem now. I turn 65 in July. She does 1 month later. How does she stay on ISMA Anthem until she is on Medicare 1 month later and starts ISMA Medigap?
Tom, did you want to take this or shall I?
Sure, this one's nice and easy. So yeah, in that situation, what we'll do is we'll automatically change the physician's policy to the Medicare supplement through ISMA effective July 1st. And we will move the spouse to a spouse-only policy under the same policy that you have right now, or same plan, just for that 1 month until she turns 65. So the premium will go down because it'll just be for her. She'll get a new identification number with Anthem. And then when she turns 65 or becomes eligible for Medicare, then we'll change her to the ISMA Medicare supplement also, her or him.
Great, thanks, Tom. This question's been asked a few times here. Do you need to continue your ISMA membership after retirement to continue to be eligible for the ISMA insurance products?
Yep, good question. So once a physician retires, they'll want to contact Vicki Riley, who's our membership coordinator at ISMA, and she'll start some paperwork to switch them from an active ISMA physician to a retired physician. And once they're retired, they'll no longer have to pay membership dues. They will be given the option, if they want to continue to read the ISMA newsletters, they can pay $50 a year, and ISMA will send them the newsletters. But otherwise, in reference to membership, once they're retired, they're dues free.
But they continue to be eligible for health insurance and the other benefits of membership.
Great. The last two questions here are around IRMAA. The premiums listed on the ISMA insurance website, are those per person or both physician and spouse?
Oh, they're per person.
Great.
Yeah, once someone switches into Medicare, health insurance is an individual. It's no longer a physician spouse type policy or husband spouse policy. Everything is by individuals. So each person will have their own Medicare ID number. They'll have their own policy. They'll have their own insurance cards, and they'll also have their own premiums.
Great. And the other question related to the IRMAA, is that a once yearly charge or monthly?
No, that's monthly. Yeah, and again, just looking at that chart will give you an idea of how much you'll have to pay. I think the highest premium for those making, maybe 500,000 plus, the highest premium for Part B, Tom, correct me if I'm wrong, I think it's around 400 and maybe $75 or $485 per month. And that's for those making $500,000 a year. So, and again, once the income goes down upon retirement, then you'll complete an SSA 44 and get adjustments made by Social Security.
Mm-hmm.
Great. Speaking of Part B, will Medicare Part B premiums change from year to year?
Oh, yes. They change every year. They don't change by much. They might just change by a couple of dollars. There were a few years where they actually stayed exactly the same. But they do change, very, very, very minor changes. So not 20% or 25%, just by maybe, a couple of dollars here or there.
Great. And our last question here, how would I find out if my physician accepts Medicare assignments?
Oh, good question. I frequently recommend that subscribers should go on to Medicare.gov, not to be confused with Medicare.com, because they're two very different websites. But if you go on to Medicare.gov and kind of scroll around that opening page, you'll find a bar that says find physician and medical facilities. And then you'll just follow the prompts. What type of or what is your zip code, and what type of a physician are you looking for? And then they'll automatically pull up a list of all the physicians that accept Medicare assignment in your zip code area. It's actually pretty simple to use. And you can also do that for procedures. I had a physician recently call that was going to have cataract surgery, and he wanted to know how to confirm that his cataract surgery was going to be paid for by Medicare. So I advised him to go into Medicare.gov, and sure enough, he put in cataracts, and there were a bunch of articles that came up, and he did find that cataract surgery was covered by Medicare.
Great. We did have one more question come in. Is the IRMAA adjusted annually based on income?
Oh boy, that's a good question that I don't actually know the answer to. I mean, it would make sense that Social Security would pass the information along to Medicare, but I don't really know that they do that. Tom, do you have any idea if it's?
Yeah, that I would have given the same answer. It seems logical that it would happen automatically, but if again, if whoever asked that question wants to shoot one of us an email or give us a call, we'll be happy to follow up on that and confirm.
Yeah, and actually, they also might want to follow up when they do some of the enrollments through Social Security. If they speak with a Social Security representative, that's actually a better question for them because they'll know how how ERM is calculated and from year to year. And I'm sorry, I just don't have that answer.
Right. Thank you, Donna and Tom. I do not see any other questions at this time. Tom, Donna, do you have any closing remarks?
Well, we just want to thank you all for participating in today's webinar. Transitioning to Medicare can be confusing and difficult, but we hope that today's discussion will make it easier for those of you who haven't already done that. And we hope that the information about choosing a Medicare drug plan is helpful, and hopefully everyone was able to get something out of today's webinar. If you have any questions down the road, please feel free to reach out to us. I'm putting up our email addresses here, but you can also reach us just by going to the ISMA Insurance Agency website, and our contact information is on there as well. So again, thanks for joining us today. We appreciate it.
Thank you.
Great. I'd like to thank Tom and Donna for sharing their expertise today. And thank you all for attending today's webinar. Please remember to complete the survey. Have a wonderful day.